Lord, we just ask you to be with us today as elected officials, leaders in the county. Help us to make decisions that considers the vision that you may have for this county, the large vision. Help us to be humble in our decisions and help our decisions and discussion lead to the betterment of Adams County, and for that matter, the state of Indiana and the United States of America. Amen.
Amen. Thanks, Doug. Okay, you should have received the minutes from the July 15th meeting. Anybody have any questions or concerns about those?
I did not, Stan.
Nope, motion to approve.
Second.
Okay, that motion passes. We'll get those to you to sign. Moving on, obviously, our auditors changed looks a little bit, so we'll
New hair too.
we'll hear from.
Better looking than the old one.
I know. I'm in favor.
Probably more experience too.
Absolutely. Okay, so what have you got for us today?
Our accounts payable.
Okay, we received the listing of accounts payable. Anybody have any questions or comments about that?
What is the figure on that?
It's kind of small this month. What's that?
Yeah, that's right.
Let's see.
Like 200 and some thousand.
Yeah, it was,
Yeah, claims to be paid on 7/23 is 270,174.74.
74, 274, so okay.
270, 174.70.
Yep.
In that regard, I move that we approve the accounts payable claims to be paid.
Yeah, I didn't have any questions. I'll second that.
okay, that motion passes.
And that one name, every time I look at it, Raquel Weinreich on probation, I always look at it and think, oh, Raquel. It's not though.
There you go.
And that's fair. Accounts payable here, yeah.
Okay, next
Well, I'm good to have
is,
Mark back.
Yeah, it's good to have Mark back.
next is payroll AP claims for the month ending July 2025 with a total of 350,965.76.
76. Sure, it's 77. Okay, payroll AP claims.
Problem with that, figure I move that we accept and approve those.
Second.
Doug and Stan. Motion passes. Get these signed here.
Next, we have our weekly health insurance claims. That is a total of 135,953.12.
Is that all medical?
You have a split on that. Let's see here. I can figure that out. Medical is 449, 380 and 55 cents.
Okay.
And prescription is 86, 320 and 25 cents.
Okay, that's good.
135.
135.
Yeah, a little bit of adjustment, but the total is 135, 953.12.
Seems like that's a little bit higher, but.
Yeah, prescription was up 80,000, 86,000 for prescriptions this month.
Any problem with that, Stan?
Yep, motion to approve.
Okay,
Second.
Stan and Doug, motion passes.
Next, we have, you want to give those to the guys, is utilities, to be paid out of our LAO.
So
Computer
these are the
vendor.
ones paid early, right? They're already
Yes.
paid.
Yes, and the grand total of those would be 35,896.31.
Okay, so anything
No
there
reason
that
not to,
concerns
no
you?
reason to question that. So
Motion
I'll
to-
move that we approve, Stan.
Second.
Doug and Stan,
Yeah.
motion passes.
It's usually about, doesn't vary that much
Yeah.
from month to month, does
Yeah.
it?
And then we have our weights and measures monthly report from June 16th, 2025 to July 15th, 2025. There was 23 that he had did, and all 23 were good.
Move we enter that report into record.
Okay,
Second,
Stan and Doug, motion passes. You guys gonna take a look at that?
That's all I have.
All right. Thank you, ma'am. Nate, what have you got for us?
Good morning.
Good morning.
Great week for a 4-H fair, it sounds like, so.
So far, so
A little
good.
easier to park out here. It's a great week for a 4-H fair.
Oh, yeah.
So it's easier to
Makes,
park
makes
here.
everywhere else in town a little, traffic a little lighter.
Well, the
Just
population
have to
of
stay
Monroe-
away from the fair.
Population of Monroe's doubled this week,
Yeah.
so. Couple of different updates for you. Start first with our, small structures for 2025. I got 2 culverts that Fleming Excavation is doing for us. Culvert 260 there between 7 South, on 7 South between 6 and 700 East. That is going to start construction today, actually. And then culvert C350, that's on 1100 South between 6 and 7 East. So both of these down the southeast corner of the county. Both of those are low posted small structures. They're going to remove both of them, and traffic will be closed on those 2 miles of road during construction. It's going to be for about a week solid for both. Crane is going to be there to set the boxes for one on Friday and another one on Monday of next week. Weather and schedule dependent, obviously. They're going to start tearing one out today.
Are
So
those are probably school bus routes, I suppose.
it's gonna be, we'll have to notify the schools, but only school should not be impacted as long as we meet our schedule, because the buses won't be going for another 2 weeks. I think school's
But
out.
I guess part of the thing is it's nice to see if those were posted
Yeah.
routes anyway, it's nice to see that upgrade.
Yeah, try to get these out, because I think both of these are below 15 tons, so I don't think either one was to permit school buses, so.
so those are concrete boxes gone
Yep,
in?
4-sided concrete boxes. We're gonna sink the bottom of these are gonna be about 2 feet below the current bottom. So we're gonna build in some capacity in that for the ditches to be dipped over the years. That's why both of these structures are posted, is that the bottom of the ditch is now below the bottom of the footing for the existing structure.
Oh.
So it makes that structure more prone to want to crack and then slip. So that's severely, is a severe negative to the load capacity of those structures. They look great on top, but once you get to the bottom, there's no soil underneath half of the foundation. So that's why they've been posted.
Are they currently metal culvert pipes in there?
3-sided concrete, so they're poured in place with a spread footer. And that spread footer is exposed, or there's a significant amount of erosion underneath those, because the bottom of the ditch is now where it was designed. There's probably 3 foot deeper now over the last 60 to 70 years that's been in place.
Will the new ones be 3-sided also?
No, 4-sided box, it'll be a solid bottom. So these won't be prone to that, but what'll end up happening is 70 years from now, when the ditch wants to get dipped more than that 2.5 feet to the bottom, the water's gonna wanna try to get underneath that at some point. But you'll have a hard mark knowing where the bottom of that ditch can be.
Yeah.
So
Good.
Out of curiosity, how old do you think the existing one that you're taking out is?
I'd be
Just
shocked.
guessing, I mean.
I'd be shocked if it's anything less than 70 years old.
70.
Both of these. So both of these, we've gotten our service life out of both of these. If
Good.
you got 60 to 70 out of these 2 structures will be well worth our investment in them.
We're not gonna see the next one.
I'm hoping none of us.
Unless
Not
something
wishing
happens.
well against any of us, but we shouldn't have to do anything with either of those. So just an update for you, for anybody that lives out there. If you live close to the structures, you'll be able to get around the barricades, but through traffic obviously won't be possible. So dispatch,
And they'll both be shut down at the same time.
one's today, the other one will probably Wednesday, Thursday. Is once one's demoed, then they're gonna move that rig out the next bridge to demo that one.
Okay.
Because they're just trying to overlap that a little
Is
bit.
the traffic such that, I'm not that familiar with that corner of the county, is the traffic such that it'll be, the fact that both of them are out, will that be a hindrance, or there are plenty of ways around those two?
Since we're 4 miles apart from each other, they
Right.
should be, it's
Yeah.
remote rural traffic, so it's local traffic. If you're driving East Ohio, it's because that's your closest way to work. It's not a major thoroughfare
Okay.
for us, so we're not gonna have a 1,000-car detour, by any means, so. At least I don't imagine it, but, certainly if I get calls, we'll handle it appropriately.
Good deal.
Updates for you on KBL. They were doing some asphalt approach work for us. I got a call like just after our meeting last Tuesday that they were going to start these on Wednesday of last week. They milled out some asphalt and chip seal approaches for 5 different bridges for us last Wednesday. And on Thursday, they got the asphalt patches back in. That just would address some of the ride and approach work, some of the joints that were there that were leaking, and they were just, whether it was ground hogs or just the natural chip seal freeze thaw damages that have been built up. So they had done that work and completed it. We did expand the area slightly on the approaches, so I'm gonna have a little more asphalt in the final tally as far as the cost than what we had before. But that just was to improve the ride, being able to pave that. Since they had significant skews, it just made good sense to expand that slightly, so.
Is KBL Lefevre?
Yes, so Mark Lefevre is the owner of that. So, yep, KBL Transport, they're out of
Portland?
Portland, and then they've got an office there in Fern. So, and then lastly, I've got an update for you on Bridge 27. Butler, Fairman, and Seifert has been working on that bridge for us for a while now. It's getting close to the bidding date. We're gonna actually bid that one next year. For federal funds, we've got money tied to that. When the project was shifted from strictly a rehab to a full replacement, we added some scope to their work, which was the foundation design, the pilings. There was also work in the below the ordinary high water mark, which changes some permitting. So they were doing work under a current contract, and I didn't allow them to file a supplement till we knew closer to what they needed to do. Now that we're getting close to the end of their agreement, we need to make some modifications. And after some back and forth between them and myself, we've settled on a supplement requesting $54,700 of additional work tied to that project with that change in scope.
What's the location of that bridge?
That's Pickle Road, just north and west of 000. So it's north of Decatur. It's in that stretch between Monmouth and 000 there. So there's a
Do
little.
we have to sign off on a supplement, or is that something?
You would need to, yes. So you should have a
I have
copy
it
of
here.
that supplement there.
Once
It-
we've approved it, we'll sign off
It
on it.
doesn't change the body of the overall agreement. It just expands with their hourly not to exceed amounts for that amount. That can bring their agreement up to
161,892 is what I've got in front of me.
sorry about that. Yes, 161,892. I've got some of the old drafts here. If you
Right.
want to see where we had started and what I had negotiated them down to, but this is, I feel that it's fair and reasonable for the additional scope of work. If you're good with that.
That's pretty significant supplement then.
It is a significant supplement, but it is a change from a rehab to a replacement. So there was no foundation design at all initially. We did a supplement for geotech at one point, and got that included into it. And this covers everything now from taking the original project to a federal aid project, and then from a federal aid project as a rehab to a federal aid full replacement.
So did you make that recommendation of replacement basically, or did?
Yes, so NDOT, when we were programming the project, there was a question of whether we wanted to do a rehab, leaving the original foundation there that's now probably about 40 years old, 50 years old, or if we wanted to do a full replacement. It's got the fluted piles on it. Could it work? Yes, but I didn't want to spend 80% of the money on an old foundation and then have issues. So for this, it seemed like a reasonable choice to go to from rehab to replacement. and it's still within our overall programming. So NDOT made that adjustment.
I don't have any problem with his recommendation here, Stan.
Yeah, well, that, since it's a federal aid project, what's our split on,
There is no split on this
there's no split on this?
because of how we were able to seek the funds. This one was one where we were able to get the funds for the project partly because we had already done a significant amount of the engineering to begin with. So it's not ideal doing it this way, but when this project had already started, about 70% of the preliminary engineering had already been completed when I had started working for the
I
county.
move we make the recommendation from Nate, a matter of record to go forward.
I'll second that.
Okay.
How many copies do you
Motion
need? You
passes.
wanna?
I'll need one and then the auditor's office will need one.
Okay, so I've got
We
two here,
can
so
do
we'll-
that.
He's got two.
You got two.
Yep.
Okay.
So, all right. Again, thank you very much. Any other questions for me?
No.
Nothing
I
for
don't.
me, Nate. Thank you.
One question on it, there is a bridge, and I don't know what number the bridge is, south of 750 north on 200 west.
Okay.
And, Brad and I were talking about that, and it's a fairly narrow bridge. Is that anything that there are any recommendations for that you know of?
I am not certain that there's any recommendations based on condition. So there's a number of things that I look at when scheduling a priority of different bridge projects, and geometry, which is what I call that. We're talking about narrow. Geometry would be one of them. Right now, what I've been going through is dealing with some of the projects that already been at some level of development when I started seeking funding for those. And then we're looking at conditions to try to extend the life of certain bridges. Bridges like what you're talking about, geometry, if the bridge is in good working order, even though it is narrow, we will probably want to try to get at the most life out of it that we can. It would be, in my opinion, it would be a convenience to try to replace a bridge just because it's narrow, if it's in good condition. If the condition of some element, whether it's foundation, deck, beams, in bad shape, then I would push that it would leapfrog a lot of other projects.
Oh,
Because
right.
geometry plus bad condition would put it against other bridges that are just bad condition. So we'll certainly be looking at those, but I'll look that up and see how narrow that is compared to others. I do have a minimum standard of what I want to see as far as width and area. I'm sure the farmers want it even wider, but there comes the cost benefit to
Well,
it.
Brad was out there looking at, I don't know if two cars can pass on that bridge or not. You think?
It'd be pretty tight.
It's pretty,
Yeah.
look at it and see what you think.
Absolutely. Yeah, I think you have, for the federal standards for a bridge to be classified as one lane, it's really narrow,
Oh,
just based on their guidance.
yeah, it's
So
probably not that.
it might be flagged as a narrow bridge. But even then, you probably don't want to be passing other cars at speed on those because, I mean, you could be down to 16 foot wide and it still not be listed as a one lane bridge. So that's the sort of categories you're at, and that's the width of a normal garage door. You don't drive 60 miles an hour past your wife's car. So those sort of numbers, when in reality, don't make sense to drivers and to understand that. And I have in the past listed a bridge as one lane, even though it doesn't meet the federal standards, because it's just something for the drivers to understand kind of the severity of it. So, no, I'll look at that, see where that's at
Yeah.
in the overall list. If it's in really good shape, I'd hate to take good beams out because you know how expensive these bridges are.
I don't know, Brad, how big is that? Do you remember?
No, I don't remember.
I mean, it's not very big.
Well, now you got me curious. I'm gonna have to be digging into it. All right, thanks for the goose chase. Gracious.
You were looking for something to do anyway, I know.
I did. Where's the papers that they had out? Is that?
Oh, you have?
There's some on the,
Nate, don't forget your
Oh,
copy.
yes, I'll grab that. Thank you.
I didn't.
What do you?
Get his handout sheets.
The handout. So
Oh, I got one right
Hey,
here.
Angie, you grabbed the stuff that was laying on the chair for them too, I believe.
Really? We had stuff from Brad too, the bunny.
Nate, here's one for Jimmy if you want.
We've got some over here.
Hey, Angie, you'll see something like this probably too.
okay.
Thank you.
Nate, have you ever been down to Metamora where they've got a bridge that carries one creek over another creek?
No, I have not.
You might be able to go down there sometime.
I'll put in a request for that.
Road trip. Road trip.
Road trip on a Tuesday.
Road trip, road
On
trip.
Tuesday.
Morning, Brad.
Good morning, guys. There again, I'll reiterate what Nate said, happy fair week, which, you know what, once a year, it's all right, and we,
Access
You
to your
know,
facilities a little.
You know, I drove by this morning, I looked at your yard and
Yeah.
your parking and I thought, oh my gosh. And the guys were out back trying to unload a tanker of
yeah.
oil or
back
something
there,
out back. I thought, gosh,
Yeah,
we're working around that.
Yeah,
For a
no.
week is,
we don't mind one bit helping
Yeah.
out, you know, cause that's the closest parking you're gonna find.
Yeah.
So, no, we don't mind it one bit.
Well, and even, wasn't it last year you opened up that back lot for parking for the?
For the, horse trailers and that kind of
Yeah.
stuff, yes, yep.
Yeah.
Well, today we have our monthly draw for the month of July. The MVH, this month, we drew $326,063.74. $326,063.74.
Well, at least we're heading in the right direction.
yeah, it's, I guess just with the exception of April, we've had an increase every month this
Yeah.
month over last year, haven't we?
And there again, which means people are buying more fuel.
Electric cars aren't having an impact yet, are they?
Not yet. On the other side, the local road and street draw for the month of July. $51,647.25. $51,647.25.
I move we accept both reports, local road, streets, MVH, as submitted.
Second. We will have to have discussions
passes.
going forward as we look into the changes in, lit taxes.
Yeah.
Because I know there is an amount that supports your department.
Right.
So we'll have to make sure that, how that all
Yeah.
fits together.
The other couple things, the knock on wood, we've had good weather, other we could use some rain, but the crews have been out chip sealing. We've got 65 miles done, shooting for 100 this year. And just to kind of reiterate the whole thing, we still get calls. Chip seal is a process to reseal up the roads, get more life out of them. And for 2 to 3 weeks roughly, you're gonna have some loose stone.
Yeah.
You know, it's something we ask they drive a little slower and stones are gonna move. And also typically too, when you get a little more rain, that helps wash them off. Well, we haven't had much rain, so they're pretty dusty. So that's just a process to help keep the roads prolong the life. The other update I have is County Road 700 South. They're from 150 to 27. The crew that does the paving and concrete is scheduled to come in Monday. So that means they'll start pouring the cement curves. And then once they're done with that, that's paving time. So the Fleming's has been doing very well. They're moving right along.
Good. So you're happy with progress down there?
Yes, the one thing, that was last week, I think, after the meeting one day. We knew that road was kind of wavy before, we figured it was soft. Once they took all the pavement off, and we went out there, Nate and I went out one day and watched, they proof rolled it, they full dump truck, drive slow. A lot of places it was really rolling. So had the gentleman down there, I think we might have mentioned this, the soil guy.
Right.
And he had a recommendation. So what they did was they dug out an additional 6 to 12 inches, you know, where they thought it was worse.
Yeah.
And then they put it in a mesh reinforcement mat. It's a big roll. It's a stiff mesh and that locks it all together that way.
Okay.
So that they're moving right along. They should be done with that in the next couple of days. And like I said, then they're ready to start on the cement paving.
What did they do when they got to 27? They went south a ways.
So all the storm drainage for that road runs down the road
To that
to
ditch?
27.
Okay,
They had to put the bigger pipe in then to take it to the
okay,
ditch.
I wonder that's what it
Yes.
looked like, yeah.
Yep.
Well, I'll tell you what, they You know, if they're gonna do concrete and any concrete next week, they got ways to go. I mean,
They'll
they're
come in
working
the
every
fall.
morning. Yeah,
Yeah.
they're early.
Yep. No, they've been doing really well. Actually,
Fleming's doing a lot of that, isn't he?
they're doing all the prep work.
Yeah.
Yep, they have a subcontractor come in and do the paving and concrete.
Yeah.
Yes, they've been doing a very good job. They're-
How wide will that road be when they're done?
20, well, back of curb to back of curb will be 24 feet. So you're gonna have about 22 feet traveling lanes. There'll be a rolled curb. That way if somebody gets up on it, it shouldn't hurt.
Now, once that project's totally completed, is that still gonna be a county portion or is Byrne taking that that half mile
Eventually,
over?
Byrne will take over that section.
That half mile,
Yes.
half mile from 27
Yep.
to 150.
And when's the targeted completion date for that?
Before school starts.
Okay, that was my only question.
Yeah.
That's
Yep,
all,
and there
that's all I
again,
needed to know.
yep, and there again, I've been in contact with the school, which way to come in and out almost every day. And, let them know, hey, projected dates, and we've had good communication at least.
Good.
Yep.
Good deal.
You talk about the expense of roads. This, of course, state of Indiana is exponentially much larger, but, they're getting serious about some of this tolling on some of the
Yeah.
interstates, like,
Yeah.
they keep talking Terre Haute to, Ohio line
Yeah.
or 65.
Yep.
But, I wouldn't be surprised the next 10 years you don't
Yeah.
see it.
Yeah.
Yeah.
Something out there.
All right, thank you.
Hey, thanks, Brad. Any other question for Brad? Guys, anything else?
Yeah.
Okay,
Yeah.
thanks. Thanks,
See,
Brad.
one of the problems though with the state of Indiana is you can get a lot of semis coming through the state of Indiana, Interstate 7, that never purchase a gallon of fuel.
Yeah,
And we're paying the price for that,
that's, was it 70,
the way it works.
75, runs from Columbus to that piece from Richmond to Indianapolis.
Busy.
And a mess. Oh, man, that thing is terrible. That's gotta have a lot of work. Anyway, Jody and Shannon, we're running a little ahead. Are you guys ready for us?
Sure.
Okay. Good morning.
Good morning.
Thanks for
Morning,
coming.
Jay.
Absolutely. Thanks for having me. Topic
Hi.
of, hi. Topic of discussion this morning is the pharmacy benefit manager that we have aligned with the plan.
Yeah.
And potential cost savings opportunities along with transparency and clinical support and stewardship by potentially moving away from our current relationship with CVS Caremark in partnering with Northwind. Northwind is an Indiana corporation headquartered in Indianapolis. We have had great success in partnering with them with other clients of ours. So we interviewed and went through analysis with 3 different potential vendors. And at the end of the day, post those interviews and reviewing information for plan savings and true partnering, Northwind really rose to the top and elevated as the partner that we wanted to present and continue to go down that path of asking for potential approval to make the plan switch. What you see on the first page is relative to the personal touch that they would give both you as the employer and the steward of the plan, as well as the members. They have a customer service support center in Indianapolis that's available 24/7. They also have clinical support from a perspective of coaching available if we go down the avenue of Diabetes Blueprint, which I want to talk about as well. And they have complete transparency in what we're spending our money on. Today, really what we get from CVS Caremark is just, here's your claims to be funded and the name of the prescription, right? So there can be and is what's called spread pricing included in that, to which we don't know truly what, at the end of the day, what the cost of the actual medication was and what CVS Caremark is retaining to put to their bottom line profits. With a full transparent model, which Northwind would be, we are charged a $6 per employee per member fee per month. And that is the only charge outside of clinical support that they have involved in their pricing. So there is no.
So for their clinical support, they do charge extra.
If there's a prior authorization, they would charge extra relative to
Cause
that.
I'm looking down this clinical blueprint, it's like almost having like another doctor. the way it-
Yes,
The
they
way it
have,
reads.
absolutely. Their clinical support is amazing what they do, even to the level of offering employees coaching and support relative to, you know, if there is a medication that is not on the formulary or something that a member is trying to get, they will help with the physician, even helping them to migrate to medications that might be more effective, just as cost effective.
So do we pay that or does the employee pay that?
So the $6 per employee per month and the prior authorization would be something the county's funding.
But the extra stuff, like clinical support,
There's no, again, other than the prior authorization, and that means if somebody were prescribed a medication today that required prior authorization and approval, their nurse evaluation and clinical support of evaluating that, there would be a charge for that. There is no charge for the clinical day-to-day support. It's just in that prior authorization pre-approval process that is coming through the plan as a claim.
so like if we pay the $6, then our employees can call in there and talk to a pharmacist and say, hey, is generic as good as whatever?
Yeah, and the $6
Or should I be mixing these meds or whatever?
Absolutely, Stan, and the $6 is the cost of for the plan to have the entire administration versus whatever CVS Caremark is keeping today, right? That we don't know what that is.
I mean, that seems like a pretty good benefit. If somebody's got questions
yeah.
on stuff like that.
Their customer service, from my experience, has been above any that I've seen relative to helping people with their farm. I mean, it's a maze for people, right? They don't know where to go, what to do, or what
Right.
questions to ask. So their customer support component of it really is what elevated them to the top in evaluating the other services of the other providers. Along with that, would we not only get the transparency, we would know the cost, the $6. There's also plan savings that we took claims from your prior administration for a period of, I think we took it through March of last year through February of this year when we did the analysis. And there's also plan savings projected with nothing else involved of $128,000 from their contracts and lower cost of the medication.
Where does that come from? That 128,000 savings? That's a lot.
That would be savings to
That's
us, right?
savings to the county
That's
and your
savings.
claims,
That's-
yeah, at the
yeah.
end of the
Money we
day,
wouldn't
right,
pay.
and that's projected, it's only as
Right.
good, right, as
Right.
what, that's saying it repeated, you know, the exact prescriptions that you had at that
Yeah.
timeline is projected, but there's definitely contractual and network savings involved in that as well.
Cause we had a pretty big hit this time in the Allied we approved for, Steve, how much of that was pharmaceuticals?
I
and
would
how
say
much
80-some thousand of that was RX.
Out of
Yeah,
130?
so I'm just gonna
35.
take one example of one medication and just, so it doesn't get tied to any personal health information. I'm not even gonna mention the medication, right?
Right.
But there's a specialty medication. You can see down here the specialty blueprint. There's a specialty medication with that medication alone is running right now about $80,000. That would go down to 16,000
Wow.
with the contract
Okay.
And that's 80,000 per
per prescription
per
for anybody on that particular
Per
medication.
year?
Yeah,
or
per month,
month?
per month.
80,000 per month?
But that person's not on it every month, so.
Okay.
But again, it's just one example of one medication that from a specialty standpoint, your specialty spend, you can see up in the light blue oblong dialogue is about 53% of your total cost. We would rather see that down to about 30 or 35, 40, which is again, one of the tactics and one of the things that the Northwind folks would work to accomplish. The other thing that you can see the cautionary up there is your ratio of the 30-day to 90-day supply spend. We think there's significant improvement that could be involved in that. And that could be added on to the plan savings, right? The 128 is reality, just what they feel they can do with their contracts and their clinical savings opportunities.
would this change have an impact on who are on the pharmacies that our clients?
Great question. No, they still have the bulk of the pharmacies around. We also would be looking at getting a conversation started with Northwind and the hospital
Okay.
to see what opportunities might exist there to collaborate and partner. Can't make any promises where that would go or what that would look like, but Northwind is absolutely interested.
Much better chance of doing
Yeah,
that than
yeah.
with CVS.
You got it.
Yeah.
You got it.
And we felt like
Yeah.
that was a win-win-win,
Yeah.
right? Bring
Yeah.
the cost
Yeah.
down for us, the employee, and then, have
And then
some.
steer
business
some-
stay in
steer
the
some-
community,
yeah.
Right?
Business to local provider.
So with, like, looking down at Humira, it says current Humira spend is 168,000. Use of biosimilars could provide significant savings. Where did we end up with are we encouraging or are we requiring the use of generics when?
So the way I
Available.
understand it, and Jody can correct me if this is incorrect, but the way I understand it is that Humira doesn't currently have a generic /
Okay.
biosimilar because of a patent on it. So it's not an option to get a generic like you would for a blood pressure medication or whatever. So a couple years ago, we implemented that copay assistance program, Prudent RX, to try to drive down the cost of specialty medications. And it has helped some, but I think that going with a different PBM altogether who already includes that specialty copay assistance program as one of their options is best case scenario for really getting that specialty spend down.
The other thing that they have available to us, which we would suggest and consider if we do make the approval, is in the diabetes blueprint that you see there, the number 1 on the population health opportunities. They have what's considered a diabetes blueprint. We have 37 members currently, representing 25% of your total RX spend for diabetes medication. Not only that, it's average expected cost on your medical spend is about 620,000 as well. The diabetes blueprint works like this. A member gets a kit of everything they need to be compliant with their diabetes diagnosis, right? It includes blood pressure cuffs, the insulin, the test strips, anything that they need to manage that comes to them at home in a kit that has the county's logo and everything on the front. They get that at zero cost. The county has a $75 per member cost involved in that for the mailing, the kit, and the supplies and everything that goes into that. We've already seen with a different county government that we've implemented this with, in the first 4 months, they monitor the A1C numbers. We've already seen in the first 4 months a significant improvement in those individuals that have engaged in that program. It's not mandatory, but it helps them remove the cost barrier and the access barrier to diabetes.
So we only pay the $75
Correct.
per user.
Correct.
Somebody
Just if
that's
somebody's using it and enrolled, Stan, yes. And the return on investment on that is significant, again, because we know a compliant diabetic, not only is the diabetes cost coming down, your medical spend's gonna come right
Sure.
down with that as well. So it would be our hope and recommendation that if we move forward with Northwind, that we would include out of the gate the diabetes blueprint. They have other blueprints. Weight loss would be the next example. I'm not ready to sit here and ask for that to be implemented yet. There's still a lot of return on investment statistics that have not been proven when it comes to weight loss. But that is another example of programs that they have in place. They have respiratory programs. They have all types of other blueprint programs that as we evolve and move down the path and can see the reduction in costs and what the improvement of employees' health and well-being is, could be considered for implementation down the road. The other thing with the diabetes management is also the mental health component of it, right? People, again, the cost consideration and the needing support to help individuals know how to manage it can have an impact on someone's mental health as well. So all of that encompassing makes that program and the investment in that provide a lot of return to cost savings for the plan on an ongoing basis.
Would the 90-day prescription provider change also?
Yes, it would be
The-
tied to
the-
Northwind. It would be Northwind's 90 day.
Northwind's
Great question.
90
Yeah,
day.
yeah, yes,
Okay.
yep. The
Right
whole-
now, it's
it's-
e-scripts or I forget
yes,
what it is.
Yes, it would. It would, yes, yeah. It would change the whole platform of that.
Okay.
Yeah. And really, a member, your employees shouldn't, we have a transition period and an implementation period, right? The first 90 days, I can tell you again, from even current, just this year's experience with the different county government, they are hands-on. If we've got a problem, they are on the phone and they're fixing the problem. In CVS Caremark, Janet can, it's
Shannon and Alec, Jody.
yeah,
fixing the
and
problem.
it's a 2 to 3 week, if that, process of getting something fixed. So their service is above none for your employees, and especially in that rollout and that first implementation, it is all hands on deck within the organization there as to how we make sure people are getting what they need, understanding the services that they help provide. They would even attend, open enrollment meetings if we wanted them to come here and be a opportunity for engagement.
How would that transition look for somebody that has a prescription currently with, who'd you say it is? Not e-scripts,
Yeah.
Express Scripts,
Yeah.
Express Scripts. How would that transition look then for somebody, something like that?
Yeah, so it's really very seamless. Again, this first 90 days, it's really getting the medications into Northwind, getting that they get loaded the prior information. So it's really very seamless for your employees in those first 90 days. Eventually, we want to track, what prior authorizations have expired, and there can be some interaction with their physician as time goes along, which you would hope for those chronic conditions are happening anyway. But during the implementation process, it's very seamless to the employees.
Okay.
Is there any benefit that we have currently that's not offered here?
Well, Shannon mentioned the Prudent RX, but they automatically incorporate with their team to
It's
find
built into
any
their program,
coupon,
huh?
any
Okay.
coupon savings available to employees. They've estimated that here at the bottom, Doug. They've not included that in their cost savings, but they've estimated those opportunities based upon the medications people are taking at $17,000 of $250. A lot of that comes in employee savings, right? Because now an employee may be paying X costs, and if they've got coupon availability, so some of that's why it's not included in your plan savings, but some of that can impact your employees and help them save dollars along the way too. But they are integrating that, and they're doing that as medications are being filled and working with employees to investigate what those other solutions are.
So on this page, this numbers page, the important page, the 128 at the top is Northwind's estimate of our actual savings realized on literal actual claims that we have already incurred if nothing changes.
Right.
Zero changes,
Yep.
no change in formulary, no change in anything.
That's just changing their contracts with their,
Right.
with their
And then at
providers.
the
with our
bottom, all
providers.
these, in the bottom left, all these other opportunities are things that they have identified that we could make adjustments to with no change in availability or service to the employee. But then we could realize the savings on the actual plan because of programs that they have available or contracts, whatever they have access to. So the top is just on actual data and the bottom is opportunities that we have.
One thing I do want to mention, we talk about the specialty component of it, and I'll use the one medication listed there as the example. If that gets moved to a different medication, biosimilar, whatever that is, it does reduce your rebates, but the savings you get from going to here significantly is much better than what
Sure.
you're getting in rebates.
Sure.
So I just wouldn't want us to sit here, mid next year and look at only rebates, because your rebates could come down because we
Right.
are transitioning.
Because you're
people.
moving to
You got it.
lower cost,
You got it.
non-rebated
You got it, yeah.
solution.
But they've accounted for that when they're showing us their savings.
Okay.
They've accounted for that rebate piece in the transition.
I'll just say one more thing. From my seat, the service part is what is gonna make a huge difference,
Yeah.
even if we don't opt into any of their programs. That savings at the top, that 128 plus the service that we'd be getting access to is the only reason I need from where I sit. I mean, I probably 6 times a year have to get involved on an employee not getting their med filled correctly, and I have to reach out to Allied and Jody, and we have to go through all this kind of rigmarole to try to figure out, you know, what's going on to get them their medication when they need it. And sometimes it is time sensitive. So I don't, you know, the service is the thing that I have really looked at and I feel strongly about with Northland.
Norfolk, now, their main offices are located in Indianapolis, you said?
Mhm. Yeah, they're headquartered in Indianapolis. They do business out throughout the country, but Indianapolis is their headquarter.
And they've been around a while.
They have been around a while, yes. Yes.
That just seems like some pretty impressive individual services, and it's, so, I mean, this isn't just a honeymoon period and then reality's gonna set in a year from now and.
Your experience is
That's
that,
not been
that
our
it's the real deal,
experience.
huh?
Yeah, that's not been our experience, Dan.
Good.
How long have they been around? I mean, not necessarily that, but how long have we had an opportunity to swing this way that we have?
We looked at it initially last year, right? So the whole PBM stuff has gotten elevated in the last, I would say 18, 24 months, right?
Probably as far, since pharmacy costs have been rising.
Pharmacy costs have exploded and gone through the roof. I feel like it started with the whole insulin and the different manufacturers raising those costs when I feel like it was post-COVID starting, right? So I really feel from a brokerage standpoint, the last 18, 24 months is when it's been apparent this is a problem and we've got to figure out solutions. Have they been around? Yes, they've absolutely been around. They do other things too. They actually have a TPA. They're a third-party administrator as well. They do other things, but in the true pharmacy space, did you find when they were? Sorry, I may have it.
I want to say he told us maybe 30 years. Does that sound?
Yeah, we can.
It'd be interesting to sit here a year from now with this page in hand and
Yeah.
say, how'd we do?
Yeah, that's the other thing, important thing, Stan, I'm glad you mentioned that, because the reporting we get is robust. We're gonna know exactly, we get monthly reports, now we get, again, you get your funding register, here's your pharmacy claims,
Yeah.
please fund it. It's truly a stewardship of the plan to go deeper diving into that. Okay, here's our spend, here's where it's at, and what are we gonna do about it?
Yeah.
Maybe nothing, maybe the spend on this category is what it is, but maybe there's opportunities elsewhere, not harming the members and improving their experience and outcomes. To truly have a partner with this.
So we have, how many county employees are we covering here?
165.
So 165, so we're almost at 25% of our people are taking diabetic medication?
Yeah,
That's a concern.
that's a huge concern. That's not to mention those that are in pre-diabetic state, that aren't aware of it.
So we have some action plans of people that could reduce that, but they fail to take advantage of it evidently.
I just don't believe that we've had the support in the past and like the guidance that Northland would give us to
Okay.
help somebody get to the point where they're managing their diabetes better, or they know that they are in a pre-diabetic stage to have that conversation with their doctor. So Jody and I have talked a lot about population health and what that might look like for the
Mhm.
county. But we have decided to take a step-by-step approach in making some changes to the plan, you know, with y'all's approval over the years to try to bring costs down. And then once we're in a place where we feel comfortable, then we're gonna start opening up to additional services and what else can we do for the long-term outcome.
Here's the key, Doug, and their proven success in driving the assistance with that. One is the clinical support and coaching by their people.
Mhm.
Two, it's removing the cost barrier because the employee is going to get that kit delivered to their home for $0. So you're removing the cost, you're removing the complicated components of the diabetes management as well.
So what, so if we move this direction, how soon, does this take effect almost immediately or?
Now, let's talk about that. So we are still waiting approval from Ally to use Northwind as our pharmacy benefit manager. They're not on their list, if you will. So we've worked with Ally, we've worked with Northwind, and absorbing the costs equating to that because Ally would
Become
have fees.
Certified or whatever.
Yep, yep. For the setup of that, we're waiting on Ally to come back to us and say, okay, because they have a vetting process in place.
Sure.
Because I I don't know this, but I have to believe that Allied does get money from the large pharmacy benefit programs somehow, somewhere along the way, as to
Sure.
having a book of business with them. Again, I cannot prove that. That's one of the things the state of Indiana has just passed legislation for, and that's complete pharmacy transparency.
Well, that's probably one of the things Matt Lehman's working on, I bet.
Possibly could be. So we would be looking for you guys to consider and approve this move, but it's gotta still be finalized with Allied to
Allied.
come back and say. Now, if they don't, then there could be an evaluation and consideration of, us moving a
Allied.
different direction.
Yeah.
So,
So if everything would work out, would it be a year from now?
January.
I'm sorry, we didn't answer that. The goal would be January 1. Yeah.
We try to make all changes on the beginning of a plan year, just to make it easier, so it would be January 1. And I believe Northwind told us they need 90 days, but the more time, the better. So we would be looking at minimum, maybe next month or September to have it approved. If you're comfortable today, you could make that decision, and it would be pending approval from Allied to use Northwind, or we can wait until we get that response and I can bring it back to you.
Would you feel comfortable recommending that we approve it today?
Absolutely.
I think, guys.
I'm fine with that, I think.
I don't see any reason why we would delay it.
Is that a motion, Stan?
Yep.
Second.
Motion passes.
You're getting stared down.
It's fine.
You have any thoughts, Mark? I mean, does it sound?
No, it's a constant battle.
Well,
Prescriptions are a constant
constant battle, but
battle.
the bottom line, most important line is if people were to be more conscious of healthy eating habits and healthy exercise, we wouldn't even be talking about that.
That's the comment from Shannon on eventually wanting to do some type of population health initiative for the employees.
And they would be involved in this though, or in that kind of an effort, or would they?
No, they would not. Typically, so we have a population health consultant on my team,
Okay.
Cheryl Scanlon, who helps employers like yourself build a program and what
Right.
that looks like. Really, the only true pure cost to that is having a vendor that's gonna capture the information. So let's say, as an example, we wanted to put in a physician requirement. You go to your physician once a year,
Yeah.
you get these biolabs, et cetera. That vendor tracks everybody that does it. It collects the physician's form. The cost for that per employee per year is $20 per employee per year. So that really is a limited cost to have, and they do the whole email campaigns, they track, they send monthly reporting to Shannon, who's done it, who's still outstanding. They build a portal that houses all this, they make it yours, right? They put your logos, your colors, all of that. They do all of that marketing and upfront implementation and launching for you and the tracking. The true cost outside of that fixed known number, if you will, is that you are initially going to see some increase in your
Sure.
lower claims, right?
Yeah.
Because you're asking people to go to the doctor, you're asking for the labs, which a lot of them are doing the labs anyway today when you're on site.
Right.
And you may find some things, right? But the good news in that is twofold. One, you're getting people engaged in their health so that we're not talking about this, right? And two, because the physician is the best opportunity to do that. And two, you're catching things earlier. So a stage 1 of a chronic condition versus a stage 4. Not to mention the cost, but let's talk about the survival rate
Yeah.
and the mental wellness and the well-being of employees with the impacts as well.
And if you catch it early enough, you might turn it around.
Absolutely.
deal.
Absolutely.
Next thing you know, you'll want us to have a fitness center in the building. Oh, wait, we do.
Oh, wait.
Might be cheaper than
Check that one
insurance.
off, Stan.
Yeah,
Question is, get people to use it.
you county employees, they get to use it free, don't they?
Yeah, full-time staff does.
Yeah.
I think it's good. We-
Good.
Yep,
We're good.
thank you.
Thanks, ladies.
Thank you
Keep
for your
keep us
time.
posted what Allied says.
Exclusion, or talk about an exclusion for GLP-1s for weight loss only.
It's not currently included in the plan.
Yeah, currently there's
So it's-
prior authorization required that would exclude it for weight loss, and there's no intent at this point to change. We'll have those conversations as we
Okay.
do implementation and setup, but at this point, we're not recommending any core change to those type things, Mark.
Okay.
That would only
Very
be
good.
done if we felt that we had enough documentation and statistics to prove that the outcomes were warranted the added cost, because there you are talking some significant costs.
Sure. Good.
Thank
Hey
you.
Shannon, will the council approve this next month? County council?
This is not a council decision.
Oh, really?
Thanks, Jody.
It's,
Involved
Rick,
money.
come on up.
you know, it's what we paid.
Come on up, Rick. I apologize for jumping over you again.
He wasn't here.
Oh, he wasn't here? All right. I didn't see him. I didn't see him. I looked back here and thought,
I've got-
my mistake, regardless,
Invisible.
regardless. Good morning.
Just some, good morning. Hi, Angie. Just updated things, our annual elevator inspection was good. Our generator here at the complex,
Mhm.
kind of noticed
No, that's.
a few Mondays ago that it cycles every morning, 7:05 on Monday mornings. It had like a jolt to it and the lights were flickering, and I never really kind of noticed that before. So I called Everpar, that's who we bought our generator
Uh-huh.
from. And they sent a check out. It's computerized, but basically him trying to explain it to me was like this. For some reason, it got off and it was throwing too much at it at once.
Okay.
So he recalibrated it downstairs, a transfer switch. Last 2 Mondays, it's been pretty seamless.
So it wasn't anything like a surge was bothering the servers or anything like that?
No, because one thing that helped that is those UPSs,
Oh, yeah.
you know, that.
That absorbed that shock, didn't
Yeah,
it?
and really, we weren't really running a lot of other things because our employees wasn't here.
Yeah.
So, um,
Good.
anyway,
Cause that would be a scary thing if it started throwing a surge into that server room.
we can't have.
And that's the reason is UPS are there. That power isn't as consistent and clean as what comes through the lines, so,
Yeah, well, to kick everything on at one time is a
yeah.
joke.
Oh, my gosh, yeah.
With that being said, this is some of my, we can have a conversation about this, but I want to bring it to your attention. That cycles every Monday, and the reason why it does is a couple of reasons that we can do. We can do it once a month. They recommended doing that, just like anything else, have a load on it, so it don't carbon up.
Yeah.
You know? But what I've noticed now since we've had the generator, here's what happens, because we don't, the brain of the for our air handlers, I wired that into a UPS. But now what I'm seeing it happens, every time that generator cycles, it kicks the air handlers out.
Mhm.
So basically your thermostats. So because they're not into the UPS. So before we had the generator, if the power went out, it would mess with the functions of it. So after that does that cycling, I gotta go in there manually and reset them after the generator runs. And the reason for that is a couple things. Our system, the front end, I'm calling it the front end that controls, that I can control this, it's outdated. I mean, everything else is new up front, and then all the security things that Mike put on, actually, it's to a place where I can't even do it no more. IT has to go in there. I have to get with Bob. And they use this certain program to get in there, but I don't know how long that's going to work. What I feel we need to do is I got to get some cost on that new front end system to run our new chillers, our boilers.
Wasn't that a real proprietary system that,
It is.
it was purchased through Hagel, they're
Mhm.
proprietary. I mean, I
Yeah.
wanna get something that's universal. We kinda had talk about this before,
Yeah,
but now it's came full circle and here's where we're at.
Sure.
cause that was one of the disadvantages of
Yes. So I guess basically, with your permission, I wanna go out and get some quotes and see what that would cost to have that done. Cause what Bob is using is something that's pretty secure. And they kind of really don't even want me to be in it. It's like through the firewall. That's what they're
Hmm.
doing. And they can explain that more to you than
Yeah.
I can, but anyway, that's something that was hindsight that came and now it's occurred and is happening, so.
interesting.
You know, that's an advantage though of having that generator set out there and actually run the building.
That's right.
We see those soft spots.
Yeah.
We have to see that because the day may come when it's out there, we need it.
Yes.
And then we need to know those soft spots at least are minimized, if not.
That's a good point. I mean,
Yeah.
that's exactly right.
That's exactly why you run that every week, including running the building with it.
One thing that popped in my head through this conversation of the generator. We haven't talked about it in a while, but our old generator. I don't know, this could be later conversation, but I don't know if there's anybody else in the county that could use it, because right now it's just sitting there. And what I'm about to do, what I wanna do is, because I just had the fuel change before last winter and it's good. I'm gonna start siphoning fuel out of that, take some over to the courthouse.
How many KW is the old one? You know, offhand?
60 or 80.
Is there
Can
any,
we get it out of there? Is it?
Well, you know, there was a tidbit of conversation, Brad, I don't know if you guys are interested in it, but when I talked with Paul,
but, okay, is the old transfer switch still with the old generator somewhere?
yes, it's still intact. I could run that other generator, but I have it locked out, because we can't have that running when the other one does. But what I do every once in a while, once a month, I ain't saying I didn't skip a month,
Yeah.
I'll go down there and run it, but not under a
Well,
load,
good for you.
just.
Just make sure it's
Yeah.
still, was there a reason that we did trade that in when you got the new one?
It was just.
No value.
They didn't know value.
Yeah.
Well,
I mean, they're
I'll tell you
really-
what, those 60 KWs in a transfer switch isn't cheap.
No,
No,
no, even a used one.
yeah, but anyway, it's just a thought.
Brad?
process.
Rick, and if I remember right, one of the bigger issues, probably gonna be getting it out of there.
Mhm.
That'll be the bigger issue.
It'll have to probably be split.
Yes.
Oh,
Yeah, we'll have to
make
take.
it more
Break-
cost
And
break
effective
that's
what it's
why it
worth.
hasn't happened yet, because it's not gonna be simple to get it
It's not
out.
gonna be
No.
simple.
Yeah.
But in preparation of that, not gonna be simple. I've left the hooks up there in the wall up on top to hook hoisting things too.
Yeah. Question, the thing of it is, sooner or later, I mean, the thing has no use here. So sooner or later, somebody's gonna have to get rid of the thing. I mean,
Too bad you let it melt to the ground down there after 100 years.
And I don't know if it's something, Brad, that we can do, or there again, we can hire a mover to get it. I don't know.
well, one thing you could possibly do is just throw it out there. There might be somebody in the community that says, hey, you know, I'll get that thing off your hand and give us something for it.
In other words, you basically advertise it, and get it out there.
Well,
So the highway
everybody knows
department
about
doesn't
it.
want it?
Well, not that we couldn't use it, we currently do have it. It only runs part of our total building.
What size is the one you have? Brad, you know offhand?
No, I don't believe it's that big, I think maybe a 50 or 55.
Yeah.
I think this would probably run what they probably run their facility.
Alright. Well,
What year is
I
it?
guess something to think about.
Got it. How old is it? Yeah, jeez.
I was thinking too, we might be able to sell it at the antique mall.
2000, Mark, or early 99. I'm sorry. But, I mean, it runs, we've had it serviced, we did work to it prior to this, so. anyway, just something to, we have that down there.
The problem is 60 KW, people are installing those things at 60 KW isn't hardly big enough to, a lot of people don't wanna mess with one that small. I mean, it's not small, but it's, I'd be surprised, I don't know. You'd have to check.
You might reach out to like our cities and towns here in the county and see if there's another county-based municipality that could use it.
You know, and like I said, I don't know what a moving company would cost to take it out of there, but.
I'm sure you'd like to have it out of your road.
Yeah.
Yeah,
But
you know, that's part of the deal. They must take, they have to
Right.
remove.
you gotta pay to get, that's where I'm going.
Yeah,
Right,
they must-
absolutely. Yeah, we wouldn't,
Make-
we're
make
giving it
Put
away.
Money in it.
We're giving it away. We're giving it away as is, where is.
Well, you could put just put the word out that if there's any other
Yeah, we might not
municipal,
be thinking about somebody that
Somebody-
thinking they
somebody
need a
out
60
there.
KW.
Somebody
Yeah.
out there might.
another
might need it.
governmental municipal entity in the county
I mean, that's an easy one.
that's
If someone's
interested in it, then you can dispose
Out of
of,
Geneva, City Decatur, who knows? Yeah.
you can
I like
dispose
the
of surplus
two-
property to
Yeah.
another governmental unit without any consideration if that's what you wanna do, except for maybe they gotta pay the cost to move it.
Town of Monroe, I don't know what they've got down there running their municipal building, but
I might be surprised, somebody might want.
Yeah.
I'll take it. Pay to get rid of it.
I mean, there's a lot of it. I think those things I mentioned last week, they're all checked off.
Okay.
Structural things. Stan,
Cool.
I think you got that. Superior.
Oh,
Yeah.
yeah, yeah, the door, yep. Well, Doug and I were talking if we would wanna ask you and see if you would get estimates to, address the things that structural evaluation at the courthouse brought up. As far as the mortar and the foundation and the stairway, the back stairway, if you
Yeah.
could get estimates, to, rechink those foundation stones and either beef up or replace that stairway, the back
Yeah.
stairway. Get some estimates for us.
Got the study done. Paid to
Yeah.
get the study done, we might
Yeah.
as well use it.
Well, and we aren't, we aren't going anywhere, so that building's gonna be there, so we
Yeah.
might as well get it repaired, especially those, yeah, those structural things are concerning.
Good. If we don't have the funds in one of our lines, then it's something that we may have to address council to.
Sure.
Their findings, do they have it descripted out? I mean, I've not seen it, Stan. They did,
I was thinking I'd send it to you, maybe I didn't, I'll find it and
just when I try to get them,
let's see
then
if I can.
I'll have it.
It gives you kind of a to-do list.
Yeah.
with that
They
building.
provided they had to provide us a summary of what they
They
recommend.
did, and
Well, that's what that's what I'm asking.
Speaking of things at the courthouse, I'm gonna show my ignorance here. Did we get the flagpole fixed?
You mean the one up on top?
Yes, the one up on
The
top.
last conversation I had, it was probably a month ago, was with John Summers.
Right.
I thought that was gonna be looked at or addressed by the end of this month.
Okay.
According to him, he was heading really that whole thing up.
Right. I knew that they were really
I know
interested
they
in that. I
allocated
was just,
money Stuff, but
you know, obviously then we need to make a decision what we're gonna do with the flagpole that sits out front. We can't have two flags there.
yeah.
So that's another whole ball wax.
Whole nother deal.
Well, now,
And that's a
What was
heck of a
John-
flagpole.
what was John
Well,
Summers' plan?
To repair, you got an estimate and we have money set aside from ARPA funds to repair the one on the top of the courthouse and set it up with a kind of a remote control, and it could be lowered to half staff and
Supposed to be.
it's fully, kind of a fully automated kind of a deal.
Because I told him, I said, any more, gentlemen, at least it was, those flags were half-staff more than it was full, it seemed like.
Yeah,
I mean, it was any little witch stitch, that thing was
I know.
shooting, whatever.
Yeah.
Call it. Whatever raised that thing up
Yeah.
inside that post wasn't working right.
Yeah, I think the
Couldn't find
estimate was,
anybody willing to crawl up there and take
the
it.
estimate was,
Stuck in there.
estimate was to replace that whole thing, I
Yeah.
think.
I
With
wouldn't mess
all
with the
with
old
new.
one, that's for sure.
Yeah,
But the thing about it is as many times as it was, is climbing that whole thing.
Yeah, we're not doing
No,
that.
nobody-
Not to lower it
We
to half
haven't-
staff and raise it back up again in
There was
2
a,
days.
there was a local that volunteered to go up there, but we were, remember that, Mark?
I took pictures of that.
Yeah, he's got
Amazing.
Yeah. Well, you're not doing it and I'm not doing it, so. We go up there once every 6 months to replace the flag. That's
Well,
about it.
Yeah, that would have to be done, and then the only other time.
So we're gonna follow up with John
Change the
Summers to
clock.
take a look at that, or what?
Do you?
Timing,
Find out
November.
Well,
find out
maybe
where we are with that.
we do away with
Yeah.
daylight savings time. We don't have to do
Yeah,
that
I gotta
again.
change that.
I forwarded that to your email
Okay,
too.
thank you. Okay. Oh, one thing I mentioned this earlier. I'd like to, kind of have this plan, not being here the rest of the week after today. What I've done is I've given a list of numbers to Phil.
Okay.
My numbers at the top of that list, electricians or whatever it may be, but I'm gonna be around, I just.
As long as you're covered.
Good.
Okay.
Is that something that you've thought about as far as having, for lack of a better word, a second in command or an assistant that is knowledgeable in a lot of the things that you're knowledgeable? I mean, just like when you talk about when the generator cycles, you have to go in and reset the air handlers. Nobody else knows that. There's things like that that nobody else, I mean, it almost seems like it would be in our best interest and your best interest to have somebody that also knows some of that.
What I've done and trying to do, because at some point in time, I'm not gonna be here. I've started kind of a, not per se spreadsheet, but the only other person that I kind of done that I'd had faith into doing it is Bob Hagues knows it. But it's not Bob's job, but he knows, just because I knew he had accessibility to get in, he would do it. But as I'm going through this journey, whenever the torch gets handed, hoping to leave it better than I found it and in a situation better than I've got this. So I am doing that. I just haven't really gave it to nobody yet.
Yeah, cause somehow I think that would be something that we would appreciate knowing that if you get hit by a bus tomorrow,
What are we gonna?
what are we gonna do? And so we have to have that,
And I've had a lot of
that
collaboration with
backup.
Mike and Bob.
Okay,
There's always, cause I work kind of hand in hand with Bob on other things, electrical, things like that. But that's where I would go seek. If heaven forbid something does,
okay.
go to him. And they can always get that off my computer too, I'm sure, or I can
Okay.
get that out
Okay, well, just don't cross the street with Bob at the same time.
Yeah.
I never go to lunch or anything.
You gotta remember though, when we're asking someone to do something that's beyond their job description. You know, somewhere when the time comes, when someone needs to be transitioned into that kind of duty and responsibility, you're gonna have to come up with a financial reward. Because you can't ask somebody to do something extra that's not in their job description. I mean, it's just fairness.
And that's a little bit of Rick, one of the things that I always encourage supervisors, managers to do is, as you're hiring, next opportunity to hire somebody, hire up a little bit. You know what I mean?
Somebody's got some mechanical skills too.
Yep.
Janitorial, what we're asking
And
is different than
if we've got to go to
janitorial.
bat with you to get the money, because it's always a money issue.
That's where.
It's always a money issue, but I'll go to council with you and say, we need, we can't just have somebody at the top and everybody else at the bottom and nobody in the middle.
Yeah.
You've got to build out that org chart such that there's,
And that's where we are.
Yeah.
And that's even with part-time help.
Yeah.
You know, you're hiring someone with janitorial responsibilities different than what Steve's talking about.
Absolutely. So somebody that may be willing to do some janitorial work, but they've got to have that upside potential that says, when the time comes, I can step it up.
And then again, like
Then
you
that
said,
person's-
it's rewarding.
It's there and it's paid.
Yeah.
Yeah.
It's got to be compensated. I get
Yeah.
that. And then you have somebody that you can begin to day to day spin some of this stuff off to, and you don't feel like, I smiled when you said you weren't going to be here the rest of the week. That's precious to me that you get out of here. But boy, the times are few and far between that phone doesn't ring and you don't have to come back in here. And I know that.
Yeah.
I would say it's like a mortician, you're just waiting for it to ring.
Yeah.
Well, I think the point is, Rick, next time you start thinking about replacing someone that's gonna retire, replacing somebody that's moved on, you know, consider very strongly the person you hire that's in that middle section that Steve was
Yep.
talking about.
Well, and as administrators, I need to think about, are these two separate parts of building? I mean, you've got janitorial and
Yeah.
custodial, but you also have maintenance.
Yeah.
And you can't always expect those to be cross-trained.
No, they don't. They don't.
And so
They're different.
with Rick being responsible for both of those duties, you know, we might have to ask him to look into something more on the maintenance.
Yeah, well, you know, you've kind of got the janitorial sides handled, but the maintenance side, you're a one-man show. So
So I mean,
we'll help you work on that.
we've kind of put ourselves in a position to,
Okay,
yeah.
food for thought. Thanks, Rick.
Thanks, Rick.
Okay. Mark, what have you got for us this morning?
We had a request a while back, about that ground that we've got located out by the jail. It's on that kind of an isolated tract there. It's 1.53 acres. And I was looking at the, that plot plan that Miller did for you guys.
Right.
And so the question is, and I'll talk with Brad and Nate here after the meeting, is whether or not we want to, consider doing an exchange of land with that individual or not. And I've done the research on it. I think we can do it. I think we'd have to have appraisals, but I think we can do an
We'll need to
exchange.
bring Doug up to speed on that. So
Yeah,
that'll
I
all
have
be
no
used.
idea what we're talking
Yeah,
about here.
that'll all be.
It's this piece out here by the jail.
Well, walk around there to his computer, Doug. I think
You
we
can-
know what we're.
You can see where we're at. It's right here along Winchester.
Oh, I know where it is.
Yeah,
Yeah, I get
it's
it.
just
Yeah,
that
you would know where it was.
Yeah, I
It's
know
just
where
that triangle, but then we also have this right of way that was railroad. So, if that were surveyed off and we just did an exchange, we could exchange this land for this. He's got this 1 acre, but it's right directly across from Village Green Drive. And so.
We like the access it gives us to the rest of our property
Mhm.
if we had control of that.
So,
The same, the person that's interested owns that.
yeah, he owns this 1 acre.
Is he interested in a change?
Mm-hmm.
Well, why wouldn't we do it?
Yeah.
Well, it's just a matter of getting the appraisals and
Yeah.
following the
I
statute.
say move forward.
I'm with you. I think
Yeah.
that gives us great access
Right.
then to the rest of that
And that
property.
triangle's worthless for
Yeah.
us.
But he could put it to use. He's got
Yeah.
a
If
commercial
he
use.
has a vision for how to use
Yeah.
that,
If he's willing.
I would
if he's
struggle,
willing
if I
to-
was him, I would struggle with giving up that. It feels like I would be separating my property, but
Yeah,
if he
if
has a
he's
vision
willing,
for that,
I'd go for it.
yeah,
So, yeah, I guess all I need from you is permission to get some appraisals ordered and
let's do it.
Yeah.
we'll see how it shakes
I don't know,
out.
Stan, are you okay with that?
Yeah,
Yeah.
I remember talking about that.
For the
Sure
record, let's move forward.
Okay.
Sounds like a good idea to me.
All right. Yeah, I just had Miller send me that sketch. I got it here this morning and he,
Good. I kind of didn't know that still had legs, so I'm glad it does.
yep. And I got a couple other things with those guys about, but that's really it right now.
Okay,
Questions for Mark?
no.
Okay. Shannon, what have you got for us this morning? Okay. Anything from the public? Guys, what have you got? What you been working on? I'll give you a quick update. If it's okay, I'll give you a quick update on, I was, telling somebody that's told this story already this morning, but, Mike Whirling had a conversation with Rod Rinkenberger, about, Monroe Town, stormwater issues. And it came about with that, our discussion of who owns the retention pond down there. And we heard that, I don't know if you heard that in drainage board. We talked about that drainage board last week. But Mike Whirling put together a meeting with Rod Rinkenberger, and Nate was there and I was there. Justin Schaefer from Town Monroe was there. Seems like I'm missing somebody, but we had a pretty good group there, sitting there at the park, talking about the retention pond that's there, and then the detention area that the Town of Monroe owns. But the good news to come out of that was that Rod believes that Maumee River Basin Commission can get involved and help the Town of Monroe, work with the Town of Monroe and with Adams County to develop a stormwater, a stormwater law, management plan for the Town of Monroe. And obviously that impacts that whole watershed south of Monroe, to put together a plan again to help the Town of Monroe. But I guess I felt really good about the opportunity to work with Maumee River Basin Commission to help one of our municipalities and our rural parts of the county to come up with a vision for how we better manage the stormwater in that area. Monroe's always been wet. It's very flat there. They've done some things to improve it, but they've never really been able to put together kind of a comprehensive plan of here are all the things that you're working with. You remember the state is talking about changing 124 as it runs through Monroe. And there's a whole question of how that's going to impact stormwater in Monroe, and how we're going to make sure that it doesn't degrade the stormwater management in the Town of Monroe. So I thought that was a neat meeting, neat opportunity to work with the Maumee River Basin Commission and our county representatives and the Town of Monroe to make things better in the Town of Monroe. So I was encouraged by that meeting. And I know that Rod Rinkenberger and Justin and Nate, I think, are going to work on trying to put together maybe next steps forward. And so this is like I said, that's a good, it could be a good partnership there that could benefit lots of different folks in our county.
Well, don't we own that pond, the county?
We do. The county Parks
So that's still in
Department.
question whether we.
It
give
is,
to 'em
it
or-
is, whether we give that to the Town of Monroe, and I think the Drainage Board has decided it doesn't really care. It's still part of the drainage system, and we would still be responsible for maintaining that drainage through that because it drains, county property south of there, and it's all,
So
it's all part of the
Rod
drainage
puts
system.
this big plan together,
Mhm.
would it be an advantage for us to still own that, or would it be?
That's the
advantage-
question. So I think that's the reason we're kind of holding now again on transferring that property. If we move down this path of a stormwater, management plan, it might be advantageous for us to continue to own the pond there, even to the point of, Nate, I think, brought to our attention that if the federal government gets involved and we need matching funds and so on and so forth, the matching piece of that could involve a transfer of the property.
Yeah.
So we're just kind of, so even though, I asked Justin, I said, get with Jeremy Gilbert, tell him what you want to do to that park. The park is really what the Town of Monroe is after control of. So knowing that the park department, the county park department, the Town of Monroe, and we have all agreed to transferring that to Monroe, ultimately, when the time is right, go ahead and begin to make plans and begin to improve that park down there, knowing that ultimately you'll have ownership of the park.
Yeah.
But the timing probably isn't perfect right now to make that transfer.
But is there even a possibility of on the retention area,
Mhm,
that is a concern for us in drainage.
mhm.
Is there even the possibility of a joint ownership?
Well, I mean, we could slice that off and give the town of Monroe the park
The
and we could
park.
keep the pond. So it's just, would just be a matter of surveying that off there. So I'm not exactly sure how that's gonna play out, but we've got a lot of folks involved now and I think we've got the right folks looking at it. So it's more than just transferring the park to Monroe. It's got bigger to include stormwater management plan and that then may be impacted by who owns the ponds.
I don't know
So
if anybody's gonna put something together, it's probably Rod.
Rod will help us find our way through that and he's
Well,
a
maybe,
guy for it.
maybe we can have,
Drain going right down underneath the football field.
They do, although we've abandoned that. That no longer is a functioning drain, the one under the football field.
To the Jets.
Yeah, we've rerouted that now around the football field, so.
maybe we can have, Mark contact the Monroe town attorney here.
Could, maybe. Figure out who that is.
Yeah, they own that. They own 12 acres just to the
Yeah,
south.
they own the, kind of that detention area that they built there, so I don't think would be foreign for them to own both ponds, but at this point, there may be some advantage to us continuing to own it for a while.
There are.
Yeah, I agree.
Grant programs where, as far as local match, donation of ground, transfer of land can go as part of your funding. So before you start changing titles, I think it'd be really behoove you to see what opportunities we have, what Rod can put together as a package for the study. Because really, there's a number of options that make this a very big, potentially a very big project for the center of the county.
Absolutely.
It could be a real feature for Monroe, and it could benefit everybody downstream of that as a result, so.
I know the town is actually looking forward to getting control of the park so they can improve the park. But they begin to talk about walking trails and some things in that, what it would be the 10 acres that they own, plus the 3 or 4 or 5 acres that's a part of the pond and walking trails and some development there. So I think there's a lot of good discussion going on right there right now. But this whole question of the stormwater management plan and who owns it and how we go about getting that funded, I think that's kind of, it's important that we wrestle that to the ground.
You do know that early on, that when they went from Burn to Decatur, they went Burn to Wilshire, Decatur, because the swamp is so bad in the central part of the county, they wouldn't go through it.
I didn't know that.
Hmm.
Yeah. Mike Worling keeps talking about how flat it is there and how, and I know the flooding just from being a resident of Monroe. The flooding has improved since they added that detention area that's to the north of the pond. It's better than it used to be, but it's still not great.
I know when I covered Monroe Town Council, Al Lehman would always say Monroe's the lowest part of the county.
Yeah.
Everything kind of funnels that way,
Everything
so
runs that
it's
way.
the lowest. If you look at the gravity, geography, it's
Yeah.
low spot.
Well, didn't we say that's why it was never made the capital of Adams County? I mean, really,
It was
cause
inaccessible.
they
Okay.
didn't
Wasn't the
choose
county
that as,
seat.
Didn't realize that, think about that.
so,
Cause
it was so low.
that's all, I think that's all I've got to report. You guys got anything?
No, I don't.
Okay, very good.
Move we
Hear
adjourn.
nothing else? Okay, move to adjourn.
Second.
Second, motion passes. We're adjourned.